After careful medical assessment, your doctor has recommended that you have a colonoscopy. This is a common and safe procedure that provides important information about the health and condition of your large intestine without the need for surgery. It is performed by a gastroenterologist, a physician trained and experienced in the procedure. Your colon, or large intestine, is a tube about 6 feet in length that forms the last part of your digestive tract. It is responsible for the absorption of nutrients and water and storage of unabsorbed food prior to its elimination. Unfortunately, it is also a common site for disease. Before the invention of colonoscopy, doctors had to rely upon X-rays from a barium enema or similar tests that provide only indirect information about the health and condition of the colon. Thanks to the flexible colonoscope, the doctor can now look directly into the large intestine, permitting close examination of any suspicious areas. Colonoscopy is performed by using a thin, flexible tube called a colonoscope. This has its own fiber optic light source and a tiny video camera lens that provides the doctor with a high-quality image on a television monitor. Controls on the end allow the doctor to move the tip of the flexible colonoscope in all directions. In addition, a variety of tiny instruments can be passed through the colonoscope to allow the gastroenterologist to painlessly obtain tissue samples of any suspicious areas. This capability can often avoid the need for surgery to obtain a biopsy or small tissue sample. Colonoscopy is usually performed to evaluate signs and symptoms of blood loss, chronic diarrhea, or other abnormalities of the intestinal tract. It also provides an important means of directly treating many types of active bleeding without the need for surgery. Colonoscopy is a particularly important means of screening for the presence of cancer or common non-cancerous mushroom-like growths called polyps. Polyps are abnormal growths in the lining of the colon which vary in size from a tiny dot to several inches. While the majority of polyps are non-cancerous, it is not always possible to tell a benign polyp from a cancerous polyp by its appearance alone. Removal of colon polyps is an important means of preventing colon cancer and avoiding the need for surgery. Before the test, be sure to discuss with the doctor whether you should adjust any of your usual medications prior to the procedure. Also, mention any drug allergies you may have, and whether you have any major diseases, such as a heart or lung condition, that might require special attention during the procedure. In order for the procedure to be complete and accurate, the colon must be empty and clean. Your physician or nurse will give you detailed instructions regarding the dietary restrictions to be followed and the cleansing routine to be used. On the day of the procedure, you will be asked to sign a consent form authorizing the doctor to perform the procedure.
Any allergies to any medicines that you're aware of?
As far as I know.
The doctor and nurse will want to know if you are allergic to any medications.
Lisa's going to start an IV on you.
Okay.
As you remember, we give you some sedatives to relax you. And
Before colonoscopy begins, the doctor or nurse will review the procedure.
what we're going to do is he's going to place the instrument into your rectum and guide it all the way around to the end of your colon, which is over here on your right side. Okay?
The doctor or nurse will inform you of possible complications from the procedure and answer any questions.
How long is the procedure going to last?
Usually about 30 minutes. Perhaps in your case it might even be a few minutes longer because, we'll probably be taking some biopsy samples. And then after the procedure, we'll take you to recovery, and generally people stay about an hour, and you're able to go home. You're able to function. You may go home and take another nap, but you're usually feeling pretty good.
Okay.
Prior to the procedure, a needle for intravenous medication will be placed in your arm. Medicine will be injected through this needle that will make you sleepy and relaxed. Because of the medication, many people do not recall any of the procedure. During colonoscopy, the flexible fiber optic tube is passed through the rectum into the large bowel. It is often possible to advance the colonoscope all the way to the end of the colon, permitting a view of the last part of the small intestines as well. After you are sedated from the medication, the doctor will examine your rectum with a gloved, lubricated finger. Then, the doctor will gently insert the lubricated, flexible colonoscope, causing a mild sensation of wanting to move your bowels. As the colonoscope is slowly and carefully advanced through the colon, the doctor will examine the bowel lining thoroughly. You may feel some cramping or gas due to the air which the doctor is putting into the colon. As the colonoscope is removed, the doctor will again examine every area of your colon very carefully. If polyps are found, they are generally removed. If other suspicious areas are seen, the doctor will usually get a biopsy tissue sample. None of these procedures cause pain. And remember, biopsies are taken for many reasons that do not necessarily mean that cancer is suspected. The total procedure will typically last from 15 to 30 minutes. Most patients consider the test to be only slightly uncomfortable, and many patients fall asleep during the procedure.
I'm going to let you recover here, let some of the sedation wear off. Then I'll sit down and I'll go over a diagram with you, show you where you're...
After the test, you will be monitored in the recovery area until most of the effects of the medications have worn off. You will probably feel drowsy and may sleep for a short time. After the procedure, your doctor will discuss the findings with you.
How was the test?
It's all right.
Wasn't too bad?
No.
Not a lot of discomfort?
No.
So just a little gas and...
A little bit gas, a little cramp in the
Okay.
stomach. Other than that, it's all right.
Well, you did very, very well. Yeah, and you were well cleaned out, so we could see you very well. Took a look around your...
The doctor or nurse will provide you with instructions to follow when you go home. Generally, you will be able to eat after you are discharged, but your doctor may restrict your diet and activities, especially if you had polyps removed. Because you were sedated, you will need to arrange to have someone drive you home from the examination. You will be advised to rest for the remainder of the day because the sedatives may affect your judgment and reflexes. Colonoscopy is a very safe procedure. Complications can occur, but are unusual. One rare complication is a perforation or tear through the bowel wall, which could require surgery. Bleeding may occur from the site of biopsy or polyp removal. It is usually minor and stops on its own, or usually can be controlled through the colonoscope. Bleeding can occur several days after a polyp is taken out. Rarely, blood transfusion or surgery may be required. Localized irritation of the vein where medications were injected may occur and may cause a lump, but this will go away within several weeks. Other unusual but possible risks include a reaction to the medication used or complications if you have heart or lung disease. For the vast majority of people, colonoscopy is a simple and safe procedure that causes surprisingly little discomfort. It provides important information to your doctor about your health and well-being. If you have any questions, please feel free to ask your doctor or nurse.